Hey, Dr. Roher, we've been getting a lot of questions. What is the best filler to use for the cheeks?
Almost all fillers are a substance called hyaluronic acid, but there's thicker and thinner hyaluronic acids. And the thin ones you put in the lips, you put in soft tissue to mimic soft tissue. The thicker ones you put deeper, you put periosteal, meaning all the way on the bone. And so in the cheek, you're going right along the zygomatic arch and you're filling that, you're making the cheek higher, more prominent, and you're pulling everything up a little. So it's great for decreasing the nasolabial folds, maybe a little jowling, and it's just a nice look. As we age, we have bone reabsorption and we lose our cheeks. So my favorite filler for the cheeks is Juvéderm Voluma. That's what its first indication was for. It has a few others. It's a thicker, more robust filler, and the thicker, more robust ones tend to last longer. So it has a 2-year indication per the manufacturer. And I will say, having seen patients long after they got filler, it probably lasts even longer than that. So it's a very highly cross-linked version of hyaluronic acid. In the Restylane line, the Restylane Contour would probably be their best filler for that area. Juvéderm does have a thicker filler called Volux. The 4 new generation fillers from Allergan are called Juvéderm Volbella, Volure, Voluma, and Volux. And they go from Volbella, the thinnest, to Volux, the thickest. So Volux is probably going to take over as my favorite filler in the cheek. It hasn't gotten there just yet. But yeah, they're all my children. So, they're all great fillers, but some are just better equipped for certain things. SD Botox, Dr. Alex Roher, signing off.